let's dive into a very common fundamentals topic of sterile fields. Now, when preparing a sterile field, you want to make sure that if you're going to be talking or somebody accidentally sneezes or the patient has been coughing, that we want to avoid that contaminating our sterile field. So we would put a mask on yourself as the preparer and the patient if needed. Next point, don't ever turn your back on the sterile field. So don't do that U-turn, don't put your back towards it. Also, we don't want to be reaching over this. This leads for an opportunity of contamination. Now, only sterile items can go in the sterile field. Now, let's say, for example, you're preparing a patient for an indwelling urinary catheter. When you clean with iodine, you don't want to put that stick of iodine back in the sterile field. You want to make sure that it goes out, because if you by any chance drop it in that clean sterile field, it's immediately contaminated and you have to throw it away. And lastly, keep the items around your torso level. You never really want them to go too far low, like by your legs, or too far high above your chest. That can be considered contamination. The general rule is about 6 inches above the sterile field. All right, I hope you learned something from today. Please screenshot if you need it, and remember that I am on other platforms if you want to follow me on those for just precautionary measures. See you soon.